Hi, I'm Dr. Gay Rodke, an obstetrician gynecologist in private practice in New York City. I've been working with Julie Tupler and Maternal Fitness since its conception in 1990. I've found over the years that her clients who do their exercises religiously and use the Tupler technique effectively have healthier pregnancies, quicker deliveries, and faster recoveries. And most importantly, they make my job easier. This is an exciting time. I hope you enjoy this videotape. I want you to do your exercises regularly, and I want to wish you a very happy birthday.
Hello, I'm Julie Tupler, Director of the Maternal Fitness Program, an exercise program taught exclusively by both registered nurses who are certified trainers and physical therapists. Maternal fitness is a missing link in childbirth education. Our program works most effectively when it is started early in the pregnancy. The purpose of this video series is threefold. Number one, to teach you about the changes your body will experience during pregnancy. 2, how to safely exercise with these changes. And 3, most importantly, how the Maternal Fitness Exercise Program can help prepare you for the marathon of labor. Suppose you're planning a long-distance bike ride. It's going to be a hard-driving trip towards a particular destination. What would you do to prepare? You'd strengthen those leg muscles that would be worked to the max, and you'd practice that pedaling movement that would get you where you're going. That's exactly what I want you to do to prepare for the marathon of labor. Strengthen the muscles, and practice the movements you'll be using so they will be second nature in labor. In this video series, you'll learn the exercises that will enable you to do just that. I will show you how to strengthen the muscles that are most vigorously involved in childbirth, the abdominals, in particular the transverse, and the pubiconchygeus, or PC, the main muscle of the pelvic floor. I will also show you how to practice using these muscles in the way you should be using them when you're ready to give birth. Getting that baby out by squeezing back on top and opening and releasing down below. That's what the Tupler technique is all about. I'm not just talking about exercises here to make you look or feel better, although they certainly will do that. The Tupler technique involves 3 elements that together, if you learn them and practice them as religiously as you brush your teeth every day, constitute a skill you will need when you're ready to give birth. The 3 elements of the Tupler technique are breathing the right way, working a strengthened transverse muscle, and relaxing a strengthened and stretched PC muscle. Video number 1 is the series of movements I call the BACS Basics. They are the bread and butter of my maternal fitness program. Learn them, practice them daily for at least 7 days before you start the full exercise routine in exercise video 2. When you get to the maternal fitness workout, you will see that the BACS Basics are incorporated into the routine, along with a lot of other stretches and strengthening exercises that all together are going to give you a great prenatal workout. The word BACS is an acronym to help you remember the basic exercises you should be doing every day. I recommend that your partner, the fetus police, watch the BACS Basics video with you. I call them the fetus police because I want them to encourage you to do the exercises that you will be learning on this video, as well as to become a better support person in labor. I would like to introduce the couples that will be doing the maternal fitness program with me.
Hi, my name is Tomoko, and this is my partner, Sean. I'm 21 weeks pregnant, and this is my first baby, and I'm due in June.
Hi, I'm Sarah. This is my husband, Matt. I'm 18 weeks. This is our first baby, and we're due in July.
Hi, I'm Mina. This is my husband, Khalil. It's our first baby. I'm 22 weeks and we are also due in June.
Let's get started. Everyone pull out your BACS Basic sheet. If you would like a copy of this BACS Basic sheet, you can go to my website, which is www.maternalfitness.com. The first B is for belly breathing, the first element of the Tupler technique. This is not really an exercise at all, but a way of life. Breathe right, whether you're pregnant or not, and everything inside works better, while everything you do outside you can do more efficiently. And now, while you are pregnant, breathing the right way is more important than ever, because you're breathing for two. Your body's oxygen requirements have increased, since the oxygen you take in is circulating not only through you, but also into the placenta to get to your baby. You will have noticed as the pregnancy progresses that breathing is harder work than it used to be, because your uterus is pressing up against your diaphragm. Correct breathing is diaphragmatic breathing, or expanding your belly as you take air into your lungs. The purpose of the belly breath is to increase oxygen supply to mother and baby and use your abdominal muscles correctly. And why do you need more oxygen? Number one, to give you more stamina when you're working out. Number two, because when you're in labor, for pain management, it's really going to help you relax. Get into the habit of it, and you will find yourself less short of breath and more relaxed. When you do the prenatal workout, you'll have more staying power because you'll be getting more oxygen. And as you know, you will be practicing one of the critical skills you will need during the marathon of labor. I dislike the word inhale because it promotes a tendency to suck in the gut, and that's not what you need to do. You do that when you're exhaling. When you get into the routine, you will see that all the movements end with a belly breath and call for you to breathe through the stretches. I will not say take a deep breath in, and I will certainly not say inhale. Usually I will say expand, and that means fill your lungs by expanding your belly. So let's do one. Put your hands on your belly. Take air in through the nose as you expand the belly. Exhale through the mouth as you bring your belly back to the spine. Belly breathing improves circulation, promotes relaxation, prevents breathlessness, gets the most amount of oxygen to you and your baby, gives you practice in the way to breathe during labor, and works the abdominal muscles correctly. Pretend your lungs are in your belly. Expand your belly as you take air in through your nose and fill your lungs. Exhale through your mouth and empty your lungs as you bring your belly back towards your spine. Spend at least 10 minutes a day practicing relaxed belly breathing. Before going to bed is a good time. When you begin practicing belly breathing, you may feel a little lightheaded because you're not used to getting so much oxygen. And now we're going on to the B for belly dancing. It's what I like to call these exercises, although they are the pelvic tilts. There are 4 belly dancing exercises in the Back's Basics. 3 you'll learn now, and the 4th you'll learn after we do some abdominal work. Each of them, despite the exotic name, involves a small, controlled movement to bring the bottom of the pelvis forward and then return it to the center. Belly dancing deals with that S-curve in the lower back, caused when the uterus comes up out of the pelvic cavity and presses forward against the abdominal muscles. During pregnancy, as the uterus gets bigger, this muscle gets longer and weaker. And as this gets longer and weaker, it brings the top of the pelvis forward, and the lower back muscle gets shorter and tighter. So then, the purpose of the pelvic tilt is to shorten, and when you're shortening a muscle, you're strengthening it from the bottom of the muscle and lengthen or stretch out the lower back. When we're doing a pelvic tilt, we want to think about the recti muscle like a string attached to your pubic bone. And we want to think about this recti muscle pulling that pubic bone towards your navel. In each pelvic tilt, we're going to be starting with a flat back and ending with a flat back. It's a very small, minimalistic movement. The first pelvic tilt we will be doing is in the on all fours position. The starting position of this exercise is with the shoulder lined up with the wrist. If you have problems with your wrist, you can put your fists on the floor to protect your wrists. Your back is flat, your hips are lined up with the knees, and the toes are tucked under in the back. You don't want your feet like this because that puts them in a pointy position and that can bring on leg cramps, so you want them tucked under. We want to make sure that we remember that the recti, the outermost abdominal muscle, is like a string attached to the pubic bone. So you want to shorten that recti from the bottom of the muscle and lengthen just the lower back and then come back to a flat back. So it's a small movement stretching out that lower back. Don't stretch out the upper back like this when you're doing the exercise. And the reason is because during pregnancy, when the breasts get larger, it brings the shoulders forward and it makes the chest short and tight and the upper back long and weak. So we don't want to make the upper back any longer than it is. So we're just working the lower back. So now I'm going to have everybody do it with me. Starting position, shoulders lined up with the wrists, back is flat, knees are hip distance apart, toes are tucked under. So we want to shorten the recti from the bottom and lengthen the lower back, and then come back to a flat back. Shorten as you lengthen the lower back. And don't use the upper back here, just relax this. Shorten as you lengthen the lower back. Good. Shorten as you lengthen the lower back, come back to a flat back. Shorten as you lengthen the lower back, come back to a flat back. Good. Shorten as you lengthen the lower back and bring your knees just a little bit further apart. That's it, good. Shorten as you lengthen the lower back, come back to a flat back. Did everybody feel that in your lower back? Okay, great. Okay, so now we're going to get up and do the next pelvic tilt, which is the hands above knees pelvic tilt. So we must get up correctly so that we protect our back and our abdominal muscles. So what I want you to do is bring your right leg way out in front of you. I want to make sure that the knee is lined up with the ankle bone. We don't want the knee forward of the ankle bone, because if you do that, it puts a lot of stress on the knee. So it has to be either lined up with it or behind the ankle bone. Put your hands on your leg, and then I want you to come and put your hand on your other leg. Now in this position, this is the second pelvic tilt, and this is the hands above knees pelvic tilt. You don't want to ever put any pressure on your kneecap, so you want to make sure your hands are resting on your thighs. For the starting position, in order to make your back flat, what I want you to do is stick out your buttocks and it'll flatten your back. Again, think of the recti like a string, and we're going to shorten the recti from the bottom of the muscle and lengthen the lower back and come back to a flat back. And Angela, don't use your legs. Now, shorten as you lengthen that lower back and then come back to a flat back. Shorten as you lengthen that lower back, come back to a flat back. Okay, let's do it. Shorten as you lengthen that lower back, come back to a flat back. Shorten as you lengthen that lower back, come back to a flat back. Good. Shorten as you lengthen that lower back, come back to a flat back. Shorten as you lengthen that lower back, come back to a flat back. Good. Shorten as you lengthen that lower back, come back to a flat back. Shorten as you lengthen the lower back, come back to a flat back. Now, keep the back flat as you come to a standing position. Did everybody feel that in your lower back?
Yeah.
Great. Now we're ready to do the standing pelvic tilt. And what we want to do here is make sure the feet are pointing straight ahead. Bend your knees and think of the tailbone pointing straight down. So we want to start with a flat back and end with a flat back. Put your hands on your hips. And again, think of that recti like a string, and shorten the recti from the bottom and lengthen the lower back, and then come back to a flat back. Shorten the recti from the bottom as you lengthen that lower back, come back to a flat back. Shorten as you lengthen, good. Bend your knees just a little bit more, good. Shorten as you lengthen, come back to a flat back, good. Shorten as you lengthen, back to a flat back, good. Shorten as you lengthen, back to a flat back. Bend your knees just a little bit more, good. Shorten as you lengthen and back to a flat. Don't stick your butt out. Back, flat back. Bring it up and back to a flat back. And Angela, at the end, don't stick your butt out like that. Start with a flat back and end with a flat back. Good. So now we're ready to start the abdominals, but first I need to teach you how to get to a seated position correctly to protect your abdominals and your lower back. So we get down the same way we got up. Put the hands above the knees. Remember, never any pressure on your kneecaps. And while we're here, we can do a pelvic tilt, shortening that recti from the bottom and lengthening that lower back. Put the hand on top of the other hand and bring the back leg back so that the front leg is in the right starting position. And then we bring the other leg down. And then we sit. So now, let's review the B column on your back's basic sheet. And we did the standing pelvic tilt, we did the hands above knees pelvic tilt, and we did the on all fours pelvic tilt. We will do the pelvic tilt in a back lying position when we're doing the A for abdominals. Now let's go to the A for abdominals. There are 3 layers of abdominal muscles. In order to understand the second element of the Tupler technique, we must teach you about these muscles. The rectus abdominis is the outermost muscle. It runs up and down and has 2 halves called the recti that are normally about a ½ inch apart and are joined together by a fibrous piece of tissue called the linea alba, which means white line. During pregnancy, the increasing bulk of the uterus pushing out against the recti can cause the 2 halves of the muscle to become longer and to separate around the belly button area. This is called a diastasis, and most women tend to develop one during pregnancy. This is a normal occurrence. However, it is important to know about it because you can prevent it from getting bigger with the exercises I will be teaching you. The function of the recti muscle is twofold: flexion, like this, of the upper body, and a support system for your back. The bigger the diastases, the weaker the support system. A weak support system may cause back problems and less effective pushing. The bigger the diastases, the harder it is to get back together after the birth. This diastasis does not go back together automatically, so you must do these exercises I am teaching you in this video after the birth also. The middle layer of the abdominals are the obliques. The obliques are underneath the rectus abdominis and attached to it at the linea alba at the bottom. The external obliques run diagonally downward from the rib cage to the pelvis. The internal obliques cross underneath the externals and run diagonally upward from the pelvis to the rib cage. The obliques are the muscles that enable you to flex your trunk and turn laterally or from side to side like this. The reason that I tell you that the obliques insert into the linea alba of the recti is because if one muscle is attached to another muscle, the action of one muscle affects the other muscle. So if I use my obliques to do crossover movements with my upper body, it will make the diastases of the recti bigger. So this means that you should not do any exercises or activities such as tennis or oblique exercises with this crossover movement. The innermost muscle is the transverse muscle, and its name suggests goes straight across the abdomen like a corset. It attaches to your bottom 6 ribs and the top of your pelvis and back. It then comes around and inserts into the linea alba of the recti in the front. The top half of the muscle goes behind the recti. The bottom half of the muscle goes in front of the recti. So if you put your hands on your belly above and below your belly button and take a big breath so that your belly button expands, the muscle that you feel going out and then in again, forwards and backwards, as we did in the belly breath, is your transverse. It is my favorite muscle. It should be your favorite muscle. Why? Because this is the muscle you're going to use to push your baby out. When doing these exercises, it's important to understand the connection between the recti and the transverse muscle. When the transverse muscle, which is connected to the recti, goes back towards the spine, it shortens the recti from the middle. Remember, when you shorten a muscle, you are strengthening it. As it goes back, it also makes the diastases smaller. Conversely, if the transverse goes forward in a forceful way, like when we bear down, it makes the recti longer and the diastases bigger. The forward movement of the transverse when taking a belly breath is a passive movement and will not make the diastases bigger. The abdominal muscles must be strengthened for pushing, and you must practice the activity of pushing. Conventional thinking says you should be gentle with your pregnant abdominals. Go easy on that bulging midsection. Don't put pressure on the baby. This, in my opinion, is as out of date and misguided as telling a normally healthy pregnant woman she shouldn't be going to work or must never lift anything over her head. First, you cannot harm your baby by exercising your transverse muscle. Your baby is very well protected inside your uterus. As you work your transverse from front to back, in the way I'll show you, your baby might be getting a little bit of aerobic workout, but he or she is not in any danger. Remember, every time the transverse goes back towards the spine, it shortens the recti from the middle and it makes the diastases smaller. Think of the transverse muscle like a sideways elevator with 6 floors. And the belly button is the engine that brings it back to the spine. First floor, the muscle is in a relaxed position. 5th floor, you are bringing the belly button back to the spine. 6th floor, you are bringing the belly button out the back of the spine. In the first exercise, which we call the elevator, we will bring the belly button to 5th floor and hold it there for 30 counts. Make sure to count, as this ensures that you are breathing. Then close your eyes and imagine the belly button going out the back of the spine 5 times, or at 6th floor. This out the back movement is just a little squeeze. So we're going to do this. So put your hands on your belly. Take air in through the nose as you expand the belly. Exhale through the mouth as you bring the belly back towards the spine. Everybody's hands should be on their belly. Now hold it at 5th floor for 30 counts. And count with me so I know you're breathing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Stay at 5th floor. Now close your eyes and see that muscle going out the back. Ready? Close your eyes, out the back. 1, little squeeze, out the back. 2, count with me. And 3, out the back. 4, out the back. 5. Let's take a belly breath. Expand the belly. Exhale through the mouth and bring that transverse back to the spine. Again, expand the belly. Exhale through the mouth as you bring that belly back to the spine. And everybody should be feeling that in your back, right over here. Yes? Okay, great. So look on your back's basic sheet to review this elevator exercise. In the next exercise, which we call contracting, we will bring the transverse from 3rd floor to 5th floor. In order to do this exercise effectively, it's important to squeeze and hold the backward movement. This means keeping the belly button at 5th floor for a moment. Count out loud on the backward movement. 1 set equals 100 of these little pulses. Do 5 sets of 100 per day. The progression of the exercise is making the movement smaller by going from 1st, 3rd to 5th, then 4th to 5th, and then from 5th to 6th as we did in the elevator. After 6 weeks of doing these exercises, you need to increase this amount from 500 per day to 1,000 per day. Once the muscle is strengthened, you can then do this exercise with a splint. The purpose of the splint is to bring the 2 halves of the recti together as you are doing this exercise. And we will show you this in the exercise video. When doing the exercise, make sure you put 1 hand on the top of the recti and 1 hand on the bottom. This is so that you can feel the top and the bottom part of the muscle going backwards. It's possible to do this exercise by bringing the bottom back and the top forward. Let me show you this from the side. By doing this, this will make the diastases bigger. Also, make sure your whole back touches the wall so that your shoulders are lined up with your hips. Do not move your shoulders, your legs, or your pelvis when doing this exercise. If a muscle is weak, it will ask another muscle to help. So we are now going to do 100 of these so you know that you can do 100. Partners, you can put 1 hand on their belly and 1 hand on their back. The hand on the belly is to make sure the whole muscle is going backwards. And ladies, you can put 1 hand on the top and 1 hand on the bottom. So let's do this contracting exercise right now. Sit up straight with your back supported against the wall or in your chair. and your shoulders are lined up with your hips and your hands on your belly. Expand the belly now and bring the transverse to the 3rd floor, which is your starting position. Now let's go to 5th floor or the spine. We're going to squeeze and hold this backward movement as we count. Is everybody ready? Expand the belly. Exhale, bring the transverse to 3rd floor. Good. Now let's go to 5th floor. Squeeze and hold. 1, squeeze and hold. 2, count with me so I know you're breathing. 3, squeeze and hold. 4, squeeze and hold. 5, squeeze and hold. 6, squeeze and hold. 7, squeeze and hold. 8, squeeze and hold. 9, squeeze and hold. 10. Angela, you're going too fast. Squeeze and hold. 13, squeeze and hold. 14, squeeze and hold. 15. You need to slow down, Angela. Squeeze and hold. 17. Hold the work part of the exercise, Angela. Squeeze and hold. 19. Squeeze and hold. 20. Squeeze and hold. 21. Angela, also just use your abdominals, not your shoulders or legs. Squeeze and hold. 23. 24. Squeeze and hold. 25. Squeeze and hold. 26. Squeeze and hold. 27. Squeeze and hold. 28. Squeeze and hold. 29. Squeeze and hold. 30. Feeling this in your back? 31. Good. 32. Partners feeling this in their back? 33. 34. Squeeze and hold. 35. Squeeze and hold. 36. Squeeze and hold. 37. Squeeze and hold. 38. Squeeze and hold. 39. Squeeze and hold. 40. Squeeze and hold. 41. Squeeze and hold. 42. Squeeze and hold. 43. Squeeze and hold. 44. Squeeze and hold. 45. Squeeze and hold. 46. Squeeze and hold. 47. Squeeze and hold. 48. Squeeze and hold. 49. Squeeze and hold. 50. Halfway home. 51. Squeeze and hold. 52. Squeeze and hold. 53. Squeeze and hold. 54. Squeeze and hold. 55. Squeeze and hold. 56. Squeeze and hold. 57. Squeeze and hold. 58. Squeeze and hold. 59. Squeeze and hold. 60. Squeeze and hold. 61. Squeeze and hold. 62. Squeeze and hold. 63. Squeeze and hold. 64. Squeeze and hold. 65. Squeeze and hold. 66. Squeeze and hold. 67. Squeeze and hold. 68. Squeeze and hold. 69. You're doing great, Angela. 70. Squeeze and hold. 71. Squeeze and hold. 72. Squeeze and hold. 73. Squeeze and hold. 74. Squeeze and hold. 75. Squeeze and hold. 76. Squeeze and hold. 77. Squeeze and hold. 78. Squeeze and hold. 79. Squeeze and hold. 80. Just 20 more. 81. Squeeze and hold. 82. Squeeze and hold. 83. Feeling this in your back? 84. Squeeze and hold. 85. Squeeze and hold. 86. Squeeze and hold. 87. Whole muscle goes back. 88. Squeeze and hold. 89. Squeeze and hold. 90. Squeeze and hold. 91. Relax your shoulders. 92. Squeeze and hold. 93. Squeeze and hold. 94. Squeeze and hold. 95. Squeeze and hold. 96. Squeeze it back. 97. Squeeze it back. 98. Squeeze it back. 99. Squeeze it back. 100. Expand the belly through the nose. Exhale through the mouth. Bring that transverse back to the spine. Take air into the nose as you expand the belly. Exhale through the mouth and bring that belly back to the spine. Great. Did everybody feel that in your back? Okay, great. So let's review now on our back's basic sheet. You may be a little sore tomorrow as you have never worked this muscle. It's important to start early in the pregnancy, as the bigger you get, the harder the exercise becomes. I hope I've convinced you by now that strengthening the transverse is critical for labor. Giving birth is a power workout if ever there was one, and the more you get that power coming from the center, the better off you'll be. As you do the transverse exercises, you'll be working the transverse through all the movements and positions in the exercise routine. Your transverse will be in on the work of everything you do. When you're doing a leg lift, when you're working your arms, I will be asking you to think of the transverse lifting that leg, lifting that arm, thinking power from the center. The transverse must be your best friend. It must be in on the work of everything that you do. When you sneeze, cough, get up and down, go to the bathroom, and when you exercise. If you do this, you will not only strengthen the transverse muscle, but make the diastole smaller, but it will then become second nature in labor. It's also important when preparing for labor to also practice the activities you will be doing. The activities that you will be doing in labor are pushing in the second stage of labor and relaxation for pain management in stage 1. We will be discussing pushing now. Pushing involves both the abdominal and pelvic floor muscles. The abdominals are the muscles up on top. The ones down below are the pelvic floor. If you think of your pelvis as a bag of groceries, the pelvic floor is the bottom of the bag. The main muscle of the pelvic floor, the PC, short for pubicoccygeus, figurates around the openings to the urethra, where you pee, the vagina, and the rectum. We will be discussing this muscle more when we get to the K for Kegels. But for now, what does the PC muscle have to do with preparing for the marathon of labor? Why is the PC muscle the third element of the Tupler technique? Well, when you're in labor, ideally, you will work the transverse and the PC muscles separately, squeezing in with the transverse to push back on the uterus and opening and relaxing the PC muscle to let the baby out. Here's another image I offer my clients. Pushing while giving birth is like getting toothpaste out of a tube. The transverse pushing back on the uterus is like your hand squeezing on the toothpaste tube. The baby, like toothpaste, comes out the bottom. Tighten the transverse and the PC at the same time, and you're keeping the cap on the toothpaste, not the best way to let the contents out. As you do the exercises, you will be isolating and separating these muscles, relaxing your abdominals as you work the pelvic floor muscles, and vice versa. Having the baby is very similar to having a bowel movement. Therefore, you can practice this activity of pushing with your abdominals back and your pelvic floor muscles open and relaxed every time you go to the bathroom, so that it will be second nature when you get to labor. Make sure your feet are up on a little small footstool about 7 inches high. This supports and aligns the bowel and makes this function easier. Put your hands on your abdominal muscles. Start with a belly breath, then bring the transverse back to the spine. Hold it there while you relax the pelvic floor muscles to have your bowel movement. You can hold your breath for a moment at the end and then take another belly breath and repeat. Most people, when they push, bear down. If you put your hands on your abdominals and bear down, you will feel your abdominals forcefully going forward and your pelvic floor muscles tightening up. Exactly the opposite of what you want to do. It also causes popped blood vessels in the face and a strain on the supporting ligaments of the uterus and bladder. You will be probably told to hold your breath and bear down in labor. Do not argue with the staff. Just close your eyes and practice that same movement you have done every time you've had a bowel movement. When they tell you to bear down, just think of bearing back, not down. Pushing with your abdominals is a new skill. It does not work unless you strengthen the transverse muscle and practice pushing with your abdominal muscles every day while having a bowel movement. You cannot teach someone a new skill when they're in pain. It's hard to teach someone a new skill when they're not in pain. Research shows that it takes at least 21 days to learn a new skill. We are now ready to do the pelvic tilt in a back-lying position. We needed to learn about the transverse muscle first because it is necessary to use this muscle when doing the pelvic tilt in this position. Since this exercise is in a back-lying position, I need to explain why it is important not to stay on your back too long. Running down the right side of your body from the heart is a large blood vessel called the vena cava. After the 4th month, the uterus gets bigger and can compress this vessel. So, if you feel lightheaded or dizzy, just roll to the side and get the weight of that uterus off this vessel. If your baby has all their weight on the right side of your body, you will not be able to tolerate this back-lying position as well as if they have their weight on the left side of your body. The pelvic tilt in a back-lying position is the foundation for the head lift. The head lift is 5 steps. The pelvic tilt is the first 3 steps. Each time you do the pelvic tilt, you must do these 3 separate and distinct steps. The starting position is with one hand on your belly and one hand at your side by the small of your back with your palm facing up. Your heels are close to your buttocks. The 3 steps are: Step 1, expand the belly with a belly breath so the muscle is in the right starting position. Step 2, bring just the transverse to the spine. Don't use your pelvis to help you do this. Once the transverse is at the spine, you need to hold it there. That's why your hand is on your belly, to make sure it does not come forward as you do step 3. So step 3 is, again, continuing to hold the transverse at the spine as you shorten the recti from the bottom by shifting or rocking your pelvis just a little. This will put the small of your back on the floor, which you will feel with your other hand. Do not use your legs to shift the pelvis. Keep your buttocks on the floor. Count as you do this shift. Before we do the pelvic tilt in a back lying position, it is important to make sure you get up and down correctly to protect the back and to prevent the diastases from getting larger. Remember, the first thing you always do before you do anything is to hold the transverse at fifth floor. So I'm going to show you now how to get to a back lying position. First of all, we have to remember to get down correctly. So I hold the transverse in, I bring my hands above here, I shift over, and I bring my leg back, making sure that my knee is lined up with my ankle bone. So getting down to a back lying position, I hold the transverse at fifth floor. Using my arms, I ease myself down until my head touches. Continuing to hold the transverse in, I roll on my back. One hand is on the belly, one hand is on the side. So I'm going to demonstrate, and then we're going to have the couples do this exercise. We're going to, step one, expand the belly. Step two, we bring just the transverse to the spine and hold it there. Again, that's why my hand's there. I hold it there as I shorten the recti from the bottom with a little shift. That puts the small of my back on the floor. And I say one. And when I do this little shift, we don't use the legs. Now, most people, when they do a pelvic tilt, they're told to press the back to the floor. And when they press the back to the floor, what happens is the transverse comes out against that weakened recti muscle. So we always want to start with the belly breath. Bring the transverse to the spine, hold it there, shorten the recti from the bottom and count. How do I get up from a back lying position? This is very important. I hold my transverse at fifth floor. Without lifting my head, I roll to the side, continue to hold the transverse at fifth as I use my arms to bring myself up from a back lying position. The worst thing ever for your back and what makes the diastases larger is getting up the wrong way. It is called a jackknife. The reason it is so bad is because, first of all, the spine does not like to be rounded. Second of all, it is impossible to hold the transverse in at fifth floor and get up this way. So let me show you what a jackknife looks like. You definitely don't want to get up this way because it is the worst way to get up. It's very hard on your back, very hard on your diastases. And all the transverse work goes out the window with one jackknife. So please don't do that. Please remember to also get up correctly when getting in and out of bed each night, and also after being examined by your doctor. Don't let them help you up by pulling you up in a jackknife. Again, always hold the transverse in, roll to the side, and use your arms to bring you back to a sitting position. Now let's do the pelvic tilt in a back lying position. Now I'm going to come to a standing position, and I'm going to make sure I get up correctly. I'm going to come on all fours. I'm going to bring my leg way out in front. I'm holding my transverse at fifth as I get up to a standing position. When you're doing this back lying pelvic tilt, remember, if you feel lightheaded or dizzy, you can roll to your side and do this exercise in a side lying position against the wall. We need the partners to help with this exercise. Partners, you'll put one hand on their belly and one hand on the side. Your job is to make sure that the belly goes forward on step one as they expand, and that they bring just the transverse to the spine, and that they hold it there as they shift their pelvis. If you feel the abdominals moving forward as they shift the pelvis, then you know they are doing the exercise incorrectly. And this can make the diastases larger. Make sure also that they do not use their legs on step three as they're shortening the recti from the bottom. Also, make sure that their heels are fairly close to their buttocks. The farther out the feet are from the buttocks, the harder the exercise becomes. So if everyone is ready, let's do some pelvic tilts in a back lying position. So make sure you get down to a back lying position correctly. Partners, put one hand on the belly, one hand at the side by the small of the back. Okay, so ladies, close your eyes so you can concentrate on the transverse muscle. Step one, we take air in through the nose as we expand the belly. We exhale through the mouth and we bring just the transverse to the spine. We hold it there as we do a little shift, putting our back on the floor and count and say one. One. Good. Again. Now release. Just let everything go and the back will come up in the air and expand the belly. Exhale, bring just the transverse to the spine. We hold it there as we shift and say two. Good. And expand the belly. Transverse to the spine. hold it there as we do a little shift and say 3. Don't use your legs, relax. Expand the belly. Exhale to the spine. Hold it at 5th floor as we do a little shift and say 4. And you let it out on that one. Did you feel it coming out? Okay, expand the belly. Exhale, just the transverse to the spine all the way back. Hold it there. Hold it at 5th floor. Now a little shift and say 5. 5. Good, much better. Expand the belly. Exhale, just the transverse to the spine. Hold it there. Little shift and say 6. Good. Expand the belly. Transverse to the spine. Hold it at 5th floor as you do a little shift and say 7. Good. 3 more. Expand the belly. Transverse to the spine. Hold it at 5th as you shift and say 8. Angela, do not move your legs on step 3. Just hold the transverse at 5th floor as you do a little movement to put your back on the floor. You don't need to use your legs to put your back on the floor. Transverse to the spine, hold it at 5th. Little shift and say 9. Last one, expand the belly. Transverse to the spine, hold it there as you shift and say 10. Good. Remember, if in this back lying position you feel lightheaded or dizzy, just roll to the side. Okay, so let's roll to the side. Hold your transverse in at 5th as you, put your head down, head down. Don't do that, what she just did. Hold the transverse at 5th as you roll to the side and bring yourself up to a sitting position. Gravity makes it very hard to hold the transverse muscle at 5th floor in a back-lying position when doing the pelvic tilt and the head lift. That's why we strengthen the muscle in a seated position first, where gravity makes it much easier to do this exercise. That is why the seated Tupler technique transverse exercise are the missing link in abdominal work. Let's review the back's basic sheet. Let's learn how to check for a diastasis. What we are doing is checking the distance between the 2 halves of the recti muscle with your fingers. It's better to do this check with short fingernails. You need to lie on your back with your knees bent. With your fingers pointing towards your feet, hold your hand flat on your belly, right on the belly button. Lift your head until you feel the 2 halves of the muscle coming together and see if you have a separation in the muscle under your hand. A 3-finger separation is considered a diastasis. If you have a separation, you will both feel and see a ridge protruding out from the middle of your abdomen. Check in the same way 2 inches above the belly button and 2 inches below the belly button. A diastasis may extend the length of the recti muscle. Check yourself when you start the maternal fitness program, and then 6 weeks after you have been doing the program, check yourself again. If your diastasis has stayed the same as your abdominals are getting longer, this is an improvement. If the diastasis has gotten smaller, that is an even better improvement. So now, let's check with our couples how to do the diastasis check. So everybody, get on your back. Make sure you get down correctly. Holding your transverse in, good. And partners, come over. So what we're going to be doing is we're going to be putting our fingers, the partners are going to be putting the fingers at the belly button. So put your fingers right here, okay? Now, don't hold your transverse in and lift your head. You feel anything there? Okay, now put your head down. Do you feel anything there? Do you feel a little separation there? Do you feel a separation? Good. We're going to bring the fingers now 3 inches above the belly button, and she's going to lift her head again. Do you feel anything? Okay, and come down. Put your head down. So now we're going to check 3 inches below the belly button. Put your fingers in there and lift up your head. Do you feel that in there? Besides feeling a separation, as I said earlier, you might see a little bulge there. Lift up your head. And we said that you also might see a little bit of a bulge besides feeling the separation, and this is what it looks like right here. Put your head down. Thanks. Okay, now, ladies, make sure you get up correctly. Hold your transverse at 5th. Without lifting your head, roll to the sides. Continue holding your transverse at 5th as you bring yourself up to a sitting position. Let's move on to the head lifts. Before you start head lifts, 2 things are important. The first is to strengthen the transverse in a seated position. This means 500 transverse every day. It takes about 2.5 minutes to do 1 set of 100. Do 200 in the morning, 200 at lunch, and 100 at bedtime. You can be driving in a car or watching TV while doing these exercises, as long as your back is supported. The second is to have mastery of the back-lying pelvic tilt. This is important because it is the first 3 steps of the head lift, which is 5 steps. Remember, anytime you are in a back-lying position, if you feel lightheaded or dizzy, roll to your side to get the weight of the uterus off that major blood vessel. Let's talk about the head lift. The purpose of the head lift is to shorten the recti from the top of the muscle, the bottom of the muscle, and the middle of the muscle. So let me demonstrate what I mean by this. So of course I'm going to get down correctly, transverse is in, and I come down here, holding my transverse in, and I get to a back-lying position, holding the transverse in, I roll to the side, use my arms, head touches, and I'm on my back. So when you lift your head, you're shortening the recti from the top of the muscle. When you're doing the pelvic tilt, you're shortening the recti from the bottom of the muscle. When you're bringing the transverse from 5th to 6th floor, you're shortening the recti from the middle of the muscle. To get out of this position, of course, without lifting my head, I hold my transverse in, roll to the side, and bring myself up to a sitting position. If you are just working the top of the muscle and the bottom of the muscle, and the middle of the muscle is getting longer, the exercise will not be effective, and it will also make the diastases bigger. Shortening the recti from the middle of the muscle, then, is the most important part of this exercise. Because you must use the transverse muscle when you do this exercise, there are several things that you need to know about the transverse muscle. Number 1, gravity affects the transverse muscle. It's hard to work the transverse muscle in a back-lying position, as you experienced when we did the pelvic tilt. 1 week of doing the seated transverse muscle exercises, and it will make it much easier in a back-lying position. After a week of doing these exercises, not only will you have this mind-body awareness of this muscle that you've never used, but you'll have the strength to shorten the recti from the middle with this transverse muscle. Number 2, the starting position of the muscle is also important. If you start the exercise with a belly breath, then it will be in on the work of the exercise. Most people breathe in opposition. They inhale and suck their abdominals in, so then the abdominals go forward from the middle as they lift their head. Number 3, the higher you lift your head, it's impossible to hold the transverse at 5th floor. And if you can't hold the transverse at 5th floor, then it will be out against a weakened recti, making the muscle longer in the middle and also making the diastases bigger. Also, it's very hard on the spine to continuously be rounded like that. To make the exercise harder, you do not lift your head higher. You make the exercise harder by bringing your heels further away from your buttocks. And number 4, the way you lift your head is very important. We lift our head like we're saying, yes. Are we going to do 500 transverse every day? Yes. Are we going to have a great delivery? Yes. So that's the way we're going to be moving our head. Do not lift your head like you're doing a turkey imitation, jutting your chin forward. Besides being very unattractive, it will make the diastases bigger because the transverse comes forward against this weakened recti when you do this head movement. Number 5, you must count. This is important to help bring the transverse from 5th to 6th floor. So here's what the head lift looks like and what we will be doing in the exercise video. And I'm going to have the couples come see what it feels like when I do this exercise. I get down correctly, I hold my transverse at 5th floor, using my arms, I bring myself to the side, and then I'm on my back. So ladies, why don't you come over here? And put your hands on my belly. Okay. The starting position, I'm in a back-lying position, and of course, I always give you the warning. If you feel lightheaded or dizzy in a back-lying position, just roll to the side. My heels are close to my buttocks because the further out they are, the harder the exercise. I'm holding the splint right over here, and the purpose of the splint again is to bring the 2 halves of the recti muscle together. So we're going to now do the 5 steps. Everybody feel my belly? Okay. Expand the belly is step 1. Exhale, we bring just the transverse to the spine. I hold it there as I do a little shift, and now my back is on the floor. And I did not use my legs to do the shift. I pull the splint, and that's to bring the two halves of the recti together. Now, when I pull the splint, I want to make sure that I end up right on the top of the recti muscle so that I can feel the direction the muscle is going when I go out the back. So I pull the splint. Now I'm going to go out the back as I lift my head and say, 1. Is it in? And I'm going to hold my transverse at 5th as I put my head down. Okay? So that's what it feels like. Now, how do I get out of this back lying position? Without lifting my head, I hold the transverse at 5th, I roll to the side, using my hands, transverse in, and bring myself up to a sitting position. So let's review the head lift under the A for abdominals on your back's basic sheet. Let's now do the A for aerobics. Aerobic exercise refers to any sustained activity that conditions the heart and lungs by increasing the efficiency of oxygen intake by the body. Swimming, running, and walking are aerobic activities, although it's not a move such as belly dancing. I'm including the aerobics here under A because when you remember your back's basics, I want you to remember also the importance of getting regular aerobic exercise. To prepare for your marathon of labor, you need cardiovascular strength as well as strong muscles. Here's what you should remember when you do aerobic exercise. You must modify both the type of activity and also the intensity. Let's talk about the type of exercise first. Relaxin, one of the hormones produced by the body, is causing your ligaments to soften and stretch. When ligaments, the inelastic bands of connective tissue that help hold your joints together, soften and stretch, your joints relax and separate. This is not all bad. Your body knows what it's doing because your pelvis must relax to accommodate for your growing baby. But that relaxin may also be affecting your joints in your shoulders, elbows, wrists, hips, knees, and ankles. That can add to your backache woes for one thing. For another, it can make you feel a little unstable on your feet, wobbly in the arms, and dismayingly clumsy as you go about your normal activities. Connective tissue laxity and joint instability added to the change in your body's center of gravity, which is now forward and higher, make pregnant women clumsier and thus more accident prone. If you were physically active and very flexible before your pregnancy, relaxin will now make you even more flexible and thus at even greater risk of falling. That's a reason to approach with caution any sports or exercises that involve bouncy movements, quick changes in direction, balance, or puts you at risk for falling. If it does, switch to another form of aerobic work. You may be at greater than normal risk of falling during step classes, high-tech aerobic classes with fancy routines, tennis, and running. If you fall, don't fall on your belly. Fall on your side or buttocks. A sharp blow to the abdominals could detach your placenta. The first sign that this might be happening is bleeding and cramping. If the relaxin goes to your pubic bone, you will feel pain there and you will have to stop exercises such as Stairmaster and stationary biking. Certain aerobic exercises are better than others because of the postural changes of pregnancy. Your hip flexors are getting shorter, which can cause backaches, so this might be a good time to avoid working out on the stationary bike or Stairmaster, which also have a shortening effect on this area. If you do want to keep going with your stationary bike or Stairmaster, be sure you do hip flexor stretches before and after exercising. When we get to the S for stretching, I will show you the hip flexor stretch. Walking, swimming, and using the treadmill may be more comfortable for you now, because these are extension or muscle lengthening activities. Tennis is especially hard on the abdominals as the crossover movement of the upper body make the separation of the recti larger. It is also hard in the knees and ankle joints because of the side-to-side movements involved. Now let's talk about the intensity of the exercise. Be careful not to get overheated. Your body temperature is already elevated by being pregnant. When you do aerobic exercise, your body temperature goes up even higher. Your body compensates by perspiring. The baby has no way of cooling down, so stay cool by drinking lots of water, wearing light and comfortable clothing, and exercise in a cool environment. Also, avoid hot tubs and saunas. Swimming is great as it's hard to get overheated. Norepinephrine and epinephrine levels have an effect on uterine muscle activity. Both of these hormones increase during exercise. Since norepinephrine increases the frequency and intensity of contractions, this increase has the potential for precipitating premature labor in a susceptible individual with rigorous exercise. The American College of Obstetricians and Gynecologists advises that the strenuous portion of your exercise routine should not exceed 15 to 20 minutes. If while you are doing aerobic exercise you feel you are getting contractions that are coming close together, stop exercising immediately and contact your healthcare provider. Losing fluids and becoming dehydrated is also a problem, as you can lose amniotic fluids, which will cause premature labor. So drink lots of water when you are doing aerobic exercise. Now the K for Kegels. Kegels is the name of the exercise of the pelvic floor muscles. The Kegel exercise was developed by Dr. Arnold Kegel, an obstetrician who studied the problems of the pelvic floor for over 25 years. Although he got a little publicity at the time, the guy was a genius in his understanding of the function and importance of this critical muscle in a woman's body. As I said earlier, learning how to strengthen, stretch, and relax the pelvic floor muscles is element number 3 of the Tupler technique. Before I teach you the Kegel exercise, it is important to give you more information on the 3 functions of the pelvic floor. The main muscle of the pelvic floor, the PC, short for pubococcygeus, figure 8s around the openings of the urethra where you urinate, the vagina, and the rectum. On a man, it figure 8s around the penis and the rectum. If you think of your pelvis as a bag of groceries, the pelvic floor is the bottom of the bag. You can get in touch with your pelvic floor muscles now by pretending to stop the flow of urine or go in the bathroom to urinate and actually interrupt the urine flow. The muscle you're pulling in is your PC muscle. However, you should not do PC strengthening exercises or Kegels while you are urinating, because that will increase your chances of developing a urinary tract infection. It's okay to do the urine stopping squeeze now, just to identify the muscle to yourself. The first function of the pelvic floor muscle is support for what's inside the pelvis, support for the groceries. Remember, I told you to think of the pelvis as a bag of groceries and the pelvic floor as the bottom of the bag. So what's in that bag of groceries? A bowel, a bladder, and a uterus. And as you know, by your 9th month of pregnancy, you have about 13.5 pounds from your baby, uterus, amniotic fluid, and placenta pressing down on your PC muscle every time you stand up. This is a load. If you are carrying around a bag full of groceries and the bottom of the bag gets wet, your groceries fall out, right? That's what happens here. Weak pelvic floor muscle is like the bottom of a bulging wet paper bag. If you don't strengthen the PC muscle, it becomes a pelvic basement instead of a pelvic floor. And then it goes to the basement and brings all the organs with it. Now you know what is between that woman's legs on your back's basic sheet. Now, I'm not saying that your baby is going to fall out. I am saying you're a good candidate at some point down the road for a prolapsed uterus, which occurs when the uterus drops down into the vagina. Now, 99% of women who are headed towards a prolapsed uterus can be cured. How? By strengthening the PC, by doing their Kegel exercises, which are named for Dr. Arnold Kegel. In fact, it is even possible these days to use biofeedback to test the muscle strength and practice working it. Many women have gained muscle awareness and technique from a unique invention available in some medical facilities. A small probe is inserted into the vagina. You squeeze on it, and then the computer tells you how strong your PC muscle is and lets you see what happens when you contract and release it. A weak PC muscle is a correctable situation. A prolapsed uterus is an unavoidable happening, and yet this remains a major cause of female surgery. Fail to strengthen the foundation, the PC, the bottom of the bag, and you're always going to have problems, surgery or not. Remember that the PC or pubococcygeus muscle, the main muscle of the pelvic floor, surrounds the urethra and rectum as well as the vagina. So the second of its functions is to aid in elimination. The PC muscle innervates the sphincter muscles to stop and start the flow of urine and to have a bowel movement. As the 9 months proceed and your uterus gets heavier, its pressure on the PC weakens the muscle. One result? Leaky urine when you sneeze or cough or do some type of aerobic exercise. Besides supporting your insides, aiding elimination, and being one of the critical birthing muscles, the PC has another function, enhancing sexual enjoyment. The vagina is normally long and narrow, the better to feel your partner's penis and experience the joy of lovemaking. After a vaginal birth, the vagina gets stretched out. You can't feel your partner's penis as well, and some of the joy goes out of sex. Once upon a time, doctors used to take their little strings and tighten up the opening to the vagina. What happened was that penetration became painful while everything else behind these strings stayed loose. It's muscular, it's all muscular. Exercise your PC muscle in the way you'll learn here, and you will shorten and tighten the muscles around your vaginal canal naturally. And start doing them now during your pregnancy, because in addition to getting them ready for the marathon of labor, it's hard to work the pelvic floor muscles after you've given birth if you've never done this exercise before. One more thing about sexual appreciation. Do your pelvic floor exercises during intercourse and you will heighten the enjoyable sensations. When you squeeze your PC muscle, your partner will feel a pleasurable tightening around his penis. If your partner squeezes his PC during intercourse, his penis will hit the top part of your vagina, sometimes called the G-spot, and that will add to your pleasure. So, to prepare the pelvic floor muscles for the marathon of labor, you must strengthen, stretch, and learn how to relax these muscles. Let's talk about the importance of strengthening these muscles first. Does something seem strange here? Why, you're asking, should you strengthen the PC muscle if the point is to relax it? Aren't you going to get too tight down there if you pump this muscle? No. What are you going to do? Develop bulk? I don't think so. If you strengthen your arm muscle, you can still relax it, can't you? It's the same thing with your pelvic floor muscles. The strength of the muscle has nothing to do with the ability to relax it. A strong muscle is a tone muscle and will stretch back behind the baby's head and not go with the baby's head. So now let's talk about the importance of stretching the pelvic floor muscles. This is one muscle you want stretchable, as they will be stretching during labor. You can stretch these muscles by doing the squatting exercise. We will be learning about that when we get to the S for squatting. Now let's talk about the importance of learning how to relax the pelvic floor muscles during pregnancy. When you're pushing in labor, ideally, you will work the transverse and PC muscles separately, squeezing in with the transverse to push back on the uterus, opening and relaxing the PC muscle to let the baby out. Remember the toothpaste image. In the pelvic floor exercises, you will strengthen the muscle, and then at the end of the exercise, practice relaxing it. You will practice seeing it open up like a little flower, another image I'm fond of. You will be isolating and separating these muscles from the abdominal muscles, relaxing your abdominals as you work the pelvic floor muscles, and vice versa. The only time to hold the transverse and PC muscle in simultaneously is when you sneeze and cough so you don't pee in your pants. Whenever you urinate or have a bowel movement, you naturally, unconsciously relax the PC. What I want you to do is become conscious of that muscle so that you will recognize what it feels like when it's open. Develop that mind-body awareness, and it will enable you to relax and open the pelvic floor muscle during labor. As with the transverse, gravity plays a part in the effectiveness in which you can exercise the pelvic floor muscles. It makes sense. When you're standing, all your groceries press down on the PC muscles. Sit, and less weight of your organs bears down on the muscle. Put your legs up against the wall, and that's an even better gravity-assisted position because your groceries are going in the other direction. In a squatting position, you have to hold those muscles in or everything will start hanging down. That's why women who live in countries where squatting is a common practice have strong pelvic floor muscles. You'll do 2 back Kegel exercises initially when you're sitting down with your legs apart and your abdominal muscles relaxed. But as you develop muscle strength, you will find it easier and easier to Kegel while you're standing or squatting. And it's great to get in as many PC holds as you can in the course of a day. Standing at the sink, chopping vegetables, waiting for a bus, driving in your car, wherever. Do a set of Kegels. Relax those muscles. While you're relaxing, you can do a set of transverse abdominal exercises. If you can't hold the PC muscle in for a count of 10, it will take you a while to strengthen it. So start with a 5-second hold, then an 8-second hold. Keep doing your Kegels sitting or with your legs on the wall if that works better. I want you sitting with your legs apart because if your legs are crossed, you will tend to use the muscles in your buttocks, and that does nothing much to help your PC muscle. And I want your abdominal muscles relaxed because these two work in reverse. Tighten down below, keep loose on top. When you're ready to push that baby out, it'll be tight on top, open and relaxed down below. So let's do the first Kegel exercise on your sheet called the 10-second hold. Sit comfortably with your legs apart and your back supported against a wall or a chair. Put your hands on your belly so that you can relax the abdominals. Pretend you have to urinate, but you're going to stop the flow. Hold in the PC muscle as tight as you can to the count of 10. Relax the muscle and feel it open like a flower, and then hold it in again. So are we ready to do that? Put your hands on your belly. Relax the abdominals. Now pretend you have to pee. Hold that PC muscle in and count with me for 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now open the muscle like a little flower and close it in, and open it up again like a little flower and close it in. Was everyone able to hold that for 10 seconds? Great. 1 repetition is a 10-second hold. Do 20 10-second holds 5 times a day. That's 100 PC holds minimum daily. Remember, you are also working 5 sets of 100 of the transverse. So after you do a set of 100 transverse, relax the abdominals and then do 20 10-second holds. If you have difficulty holding in your PC for 10 seconds at a time, remember, start with a 5-second hold or do the Kegel exercise in a gravity-assisted position with your legs up on the wall. This is a stretch I will be showing you how to do when we get to the S for stretching. The relaxation part of this exercise is important. You need to be able to release and relax the muscle as a preparation for pushing during labor. As we've previously discussed, a good time to practice this relaxation is while having a bowel movement in the morning. Transverse muscle pushes back, pelvic floor muscle is open and relaxed. Also relax the muscle at the end of each 10-second hold, and also be conscious of relaxing the PC muscle when doing the abdominal exercises. The next exercise we will be doing is the elevator. As with the transverse abdominal exercises, you're going to imagine the muscle is an elevator, but this time it's going upwards instead of sideways. Your pubic bone is first floor, your belly button is 5th floor. Again, sit comfortably with your legs apart and your back supported, relax the abdominal muscles, and we're going to imagine a penny on the seat of your chair. You're going to pick up the penny with the lips of your vagina and think of the elevator with 5 floors, and the belly button being the 5th floor. Bring the penny up, 1st floor to the 2nd, to the 3rd, to the 4th, to the 5th. We're going to hold the penny here at 5th floor, and we're going to count to 5, and then we're going to slowly bring the penny down to 4th, to 3rd, to the 2nd, to 1st. We're going to open it up and then close it in. So, is everybody ready? Okay, relax the abdominals. Pretend there's a little penny on your chair. Pick that penny up. Now go to 1st floor, up to 2nd, up to 3rd, up to 4th, up to 5th. Hold it at 5th floor. Count with me for 5. 1, 2, 3, 4, 5. Hold it at 5th floor. Now bring it slowly down to 4, to 3, to 2, to 1. Open up like a little flower, let that penny go, and close the muscle back in. Do 10 elevators at a time, at least 5 times a day. If the downward movement is difficult for you, and as you're coming down your elevator crashes to the basement, don't worry. As the muscle gets stronger, the downs will be more controlled. This exercise, like the first Kegel exercise, is also a 10-second hold. Up for 5, then holding for 5. It's just a different way of working this muscle. I would also like to discuss for a moment a surgical procedure that is done during birth that affects the pelvic floor. I would like to say it is a myth that a woman needs some surgical assistance to get the baby out. They teach this procedure in medical schools because they feel the baby's emerging head might tear the perineum. Therefore, they cut so the perineum won't tear, and a straight cut will heal better than a jagged tear. To start with, this is faulty reasoning. What happens when you cut a slit in the side of a piece of fabric? It can still tear, right? In fact, it will tend to tear even more easily. So cutting does not stop the perineum from tearing. If you tear, the opening will have jagged edges, and yes, those are harder to sew up, but in fact, zigzagged edges naturally close and heal more effectively. Also, scar tissue from an episiotomy further weakens the pelvic floor muscles, which have been weakened from the pregnancy. A weak pelvic floor muscle, as we discussed, can cause long-term problems. The American College of Obstetricians and Gynecologists state that episiotomies should not be routinely used in untroubled births. So while it's important to prepare your pelvic floor by strengthening, stretching, and learning how to relax it, this doesn't make any difference if your doctor or midwife routinely does episiotomies. So it's important to interview your doctor on this subject. I would like to show you how to interview your doctor or midwife regarding this subject. Here's an interview I did with Dr. Rodke. Dr. Rodke, how do you feel about episiotomies?
Well, I try really hard not to do them. For many women, the recovery from the episiotomy is the worst part of the childbirth experience, and for most women, I don't find them necessary. I find that women have a happier time with their newborn and quicker, easier recoveries without stitches.
When do you find episiotomies necessary?
Well, I'd say about 1% of the time, if the baby's in distress and a few extra minutes of easing the baby out into the world would make a difference to the baby's health, in that instance, especially if there's an instrumental delivery, I might find that a small incision would facilitate a quicker, safer delivery for the baby.
What do you do to prevent doing episiotomies?
Well, we start before the baby's ever born by working at having a good working relationship with the patient in which she can trust me and accept my direction, does her exercises and knows how and when to push and not to push is the first most important step. During the process of birth, we engage in certain breathing techniques, careful pushing during the crowning of the baby and after, and I use techniques to both support the perineum and ease the baby through in order to allow the tissues to accommodate to the emergence of the baby's head.
And that is called the perineal massage?
Well, perineal massage is part of what we do. Support of the perineum is another part of what we do. And probably the most important thing is coaching women to push when it's helpful, and then, more importantly, to not push too fast at the point at which the baby's head is beyond crowning, so that the tissues have a chance to adjust.
And do you think learning how to relax the pelvic floor muscles for birth is important?
I think that's very important. I think that it's important for women to learn to control their pelvic floor muscles for many reasons, but that's one of the more important ones. There are good studies that show that women who don't have episiotomies incur smaller lacerations than the episiotomy they would have had. For doctors, some people feel that it's easier to sew a straight cut than it is to sew a free-form tear that may or may not occur in the place they're used to sewing. Most lacerations, if they do occur right where the episiotomy would have been, and again are smaller than the episiotomy would have been. And if you get really good at these techniques, most women don't need stitches at all.
So it is harder to sew a tear than a cut.
It can take more skill depending on where the laceration occurs and depending on how big it is. Tiny lacerations that don't require stitches are much less uncomfortable than episiotomies or lacerations that do require stitches. I think that the discomfort from a similarly sized tear or cut is about the same.
What are your percentage of episiotomies?
Well, most years less than 1% for both first-time moms and repeats.
And if you have an episiotomy, can you still tear?
Certainly. Once you have cut the tissue, it's actually easier for the tissue to tear further, to actually extend the episiotomy. We call it extending the episiotomy and tear into adjacent structures. Tears into the rectum are much more common in women who have had episiotomies than women who don't. The major effect on the pelvic floor muscles occur from the long period of pregnancy, the weight on the pelvic floor structures, the period of pushing. I think that the last few minutes of birth, whether with an episiotomy or without, makes much less difference than a lot of other factors. A woman's genes, how big her baby is, how quickly it comes out. There are a lot of other factors that determine her long-term pelvic health. I think that doing proper exercises both before delivery and after can help a woman have better control, potentially have fewer injuries during childbirth, and certainly can help her recover faster and have a healthier pelvic floor in the long term.
Great, thank you. Let's move on to the S for squatting, stretching, and strengthening. I consider squatting the ideal position from which to give birth because the outlet of your pelvis is opened up, your weight is supported on your thighs, and gravity is on your side. Practice squatting as part of your back's basics, and you'll be better prepared to use the position if you choose during labor. Squatting is a wonderful exercise in general, one that can greatly benefit many parts of your body. It's a natural position, although most of us rarely use it. Preschool-age children squat easily and all the time. Later, they begin to sit in chairs for prolonged periods. As a result, the calf muscles tighten, the joints of the ankles and back become stiff, and they grow to be people who don't squat. We all need to re-experience the pleasure of squatting. It strengthens the muscles in the knees, thighs, and buttocks. It strengthens the abdominal muscles, especially the obliques, because squatting realigns the pelvic geometry so that the abdominals are more efficiently brought into use. And it helps to stretch and relax the lower back by reducing that S-curve in the lower region, relieving the muscles and ligaments that support the spine, and lessening pressure on the disc between the spinal bones. Squatting stimulates circulation to the pelvic area and strengthens and stretches the pelvic floor muscles. And you know that's something to be desired when you're ready to give birth. Also, as a posture of elimination, it supports and aligns the bowel to produce an easier and more complete evacuation. The man who invented the toilet was a plumber, not an anatomist, and did not recognize in his design the natural advantage that squatting offers the body. While reinventing the toilet is not practical, you can approximate the squatting posture and help unkink your bowel by using a small footstool about 7 or 8 inches high to elevate your feet when you are having a bowel movement. If you have a small square wastebasket in your bathroom, just turn it on its side and put your feet on it. The bowel is supported and elimination is aided. And if constipation has been a problem during your pregnancy, you need all the help you can get. Squatting is not hard on normal knees, not if you get down and stay down for a while. It's getting up from the squat that's hard on the knees. If you normally have problem knees, or if you have pain in your pubic area, or have varicose veins, consult with your doctor before doing these exercises. When you're first starting out, hold on to something. This is a supported squat. Hold on to the end of a non-movable piece of furniture, a railing, a door jamb, and ease yourself down into a squatting position. During labor, 2 people can support you under your arms in a supported squat. If you've practiced squatting during your pregnancy, it will be a more natural position for you during labor. And after the baby is born, remember to hold your transverse in and keep squatting whenever you pick something up. Let me show you how to do it now. We're going to stand with our feet flat and wide apart. We're going to hold on to an immovable object such as a railing or door, or in this case, we're going to be holding onto our partner's legs, and we're going to descend gradually and without bouncing to a squat. So everybody, let's get to a standing position. Make sure you get up correctly. And the partners, you need to bend your knees just like that. Just like that, good. All right, great. So we're going to be using our partner's leg as our immovable object, but if you're at home and your partner isn't there, you can use a railing or a door jamb. And what we're going to do is descend gradually and without bouncing to a squat, bending your knees, making sure your heels are on the floor. I'm going to demonstrate the supported squat now. You slowly descend, you hold on to the back of their legs. This is our immovable object now. Remember, my arms are straight, my arms are shoulder height, my legs are hip distance apart. Remember that the knee is lined up with the ankle and the feet are pointing straight ahead. And the weight is on the outside of the feet. Now, do not get up from the squat. That's very hard on the knees. What you need to do is hold your transverse in, put one hand down here and one down here, and sit yourself down to get out of the squat, and then get up the way we learned earlier. So now let's have the couples do it. So always remember to go down slowly when you're doing this exercise. So let's begin. Come down slowly, holding on to the back of their legs. Now, your arms are straight, feet are hip distance apart, weight is on the outside of the feet. Does everybody feel that stretch in your lower back? Okay, while we're in this supported squat position, we're going to do a Kegel exercise, because all the weight of the organs are pressing on these pelvic floor muscles. So doing the Kegel exercise in this position is a little bit more difficult. So relax your abdominals now. Hold that PC muscle in and give me a Kegel exercise. Count with me for 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Open it up like a little flower and close it in. And open it up like a little flower and close it in. Was this a little bit more difficult in this position than in seated? Okay, now we're going to get down correctly. Hold your transverse in. Put one hand down behind you, the other. Sit yourself down. And then bring yourself back to your chair. Start with a 15 or 20-second squat several times per day. Work up to holding the position for a minute at a time, then gradually up to 5 minutes at a time, 5 times a day. If you have trouble getting your heels on the floor, try straightening your arms and pulling away more from the object you are holding on to. If that doesn't work, you can try putting a rolled blanket under your heels, wear low heels, or sit on a short stack of books. You may find your legs go to sleep at first, but your circulation will improve as you continue practicing your squats. Try reading a book or magazine while squatting. It makes the time go faster. As your belly gets bigger, continue to widen your squatting stance to accommodate for it. Get out of the squat correctly. Do not stand up from this position. This is very hard on your knees. Get out of the squat by first holding your transverse in, putting one hand down, then the other, and then your butt on the floor. Remember also to get up correctly as you learned earlier. To get to a standing position, get in the on all fours and then into the hands above knees position. Now let's do the S for stretching. Stretching is nature's prescription for relaxing the body. It's stress relieving and it keeps you flexible where you want to be flexible. And you know that stretching is also the way to lengthen those muscles that have been shortening up in your pregnant body. You've done some of that work already with the pelvic tilts and squatting that gently stretched out the muscles in your lower back. And we've discussed stretching the pelvic floor muscles with squatting. Now we're going to add 5 exercises that are going to stretch the muscles in your chest, those pectorals that have been getting shorter as your shoulders and neck have come forward, and in your legs. These muscles are the hip flexors, the inner and outer thighs, and the back of your legs. There are 2 basic ways to do stretching exercises. One is incorrect and the other is correct. Here is the incorrect way. Stretch whatever muscle it is you're working as far as it can go and then perform quick, repetitive bouncing movements. This is called ballistic stretching and it's very harmful for the body. It can actually, in fact, shorten the muscles you want to lengthen because of a protective reflex contraction, and it increases your chances of tearing muscle fibers. Never bounce. Never stretch beyond the point at which you feel discomfort. Static stretching is the right way to go, and that involves a slow, deliberate stretch through the muscle's full range of movement until you feel a tightness or resistance in the muscle. Stop before you feel pain. You will then hold the stretch for up to 30 seconds and then relax. I love the idea of putting your mind in your muscle. Develop the habit of mentally focusing on the muscle you're working. You'll do the exercises more efficiently and get good practice in a technique you'll want to use on the big day to help deal with the stretching sensations of those muscles in your pelvic floor area. As you do these stretches, close your eyes and visualize the muscle. First, take a moment or two to see the muscle relax. Tense muscles are in a shortened position, and then see it lengthening as you breathe through the stretch. So let's start with the chest stretch. Sit in a chair or on the floor with your back nice and flat, holding the ends of a long sock or a small towel, anything that doesn't give too much. Bring the towel behind your head. Keep your elbows below your shoulders. Gently bring your elbows back behind your shoulders, and without arching your back and keeping your wrists flat, hold the stretch for 15 to 30 seconds. Relax. Do at least 10 chest stretches a day. If you spend a lot of time sitting at a desk, try to incorporate pectoral stretches at least once an hour. So now let's do the chest stretch. We're going to take the splint, we're going to hold it, we're going to bring it behind. Make sure that you keep the wrist flat. Make sure that the shoulder is lined up with the hip. And when you do this exercise, just make sure the elbows are below the shoulders. The wrists are nice and flat. Now we're going to bring the elbows back without arching the back. And we should feel the stretch right across the chest here. Does everybody feel that chest stretch? Now remember, when you do this, don't arch your back like that. Make sure that you're sitting on your sits bones, shoulders are lined up with the hips. Okay, relax. Great. While we're in this position, we're going to do the back of the leg stretch. So we're going to sit on the floor with one leg straight in front of you. Make sure that the foot is lined up with the hip. Hold on to the splint and make sure you go once and twice. Now, we want the upper body lined up with the hips. I don't want you coming forward. That rounding is hard on the spine. Sit on the floor with one leg straight in front of you, the foot lined up with the thigh, the other leg bent at the knee, the foot resting against your opposite knee. Your shoulders should also be lined up with your hips. So we have a scarf or a long piece of fabric around our foot, and we wrapped it around our hands. Now, let's close our eyes and see the muscles around your knee and the back of your leg just relaxing. We always want to relax the muscle before we stretch it. Pull your foot with the scarf toward your knee and feel the stretch around your calf. Now sit up straight and think of sticking out your buttocks. You should now feel the stretch running down the whole back of your leg. Now let's breathe through the stretch. Expand the belly. Exhale through your mouth as you bring the transverse back to the spine and see that muscle running down the back of your leg. Release, relax, and lengthen like a piece of silly putty. Just hold the stretch for a few seconds more. Let's take another breath. Expand. Transverse to the spine as you see that muscle release, relax, and lengthen. Okay, let's do the other leg. Okay, we're going to do the other leg now. We're going to have one leg straight ahead. The foot is lined up with the thigh. The other leg is bent at the knee, the foot resting against your opposite knee. Your shoulders should also be lined up with your hips. We have our scarf or piece of fabric wrapped around our foot and around our hands. Now close your eyes and see the muscles around the knee and running down the back of the leg. See those muscles just relaxing. We always relax the muscle before we stretch it. Now, pull your foot with the scarf towards your knee and feel the stretch around your calf. Now sit up straight, stick out your buttocks, and you should now feel the stretch running down the whole back of your leg. Now let's breathe through the stretch. Expand the belly. Exhale through the mouth as you see that transverse go to the spine and see that muscle release, relax, and lengthen. Expand the belly. Transverse to the spine as you see that muscle release, relax, and lengthen. One more. Expand the belly. Transverse to the spine as you see that muscle release, relax, and lengthen like a piece of silly putty. Okay, relax. Did everybody feel that in the back of your leg? Okay, great.